Hello everyone. So today we'll be discussing another important topic, that is drug distribution. And we all know that this distribution is a part of the broader topic, that is pharmacokinetics. So what do we mean by this pharmacokinetics? It is what the body does to the drug. So what the body does to the drug is it either absorbs the drug, then it distributes the drug, then there is metabolism of the drug, and finally there is elimination of the drug. So these are the four parts of the pharmacokinetics: absorption, distribution, metabolism, and elimination. So coming to what is distribution. So distribution is the delivery of the drug to the tissues. So what happens once the drug has gained its access to the bloodstream, then it binds with the plasma protein. Okay. So there are two forms of the drug. One is the bound form and another is the free form. The free form gets distributed into the various tissues that initially had no drugs. So the concentration gradient of this being in the direction from the plasma to the tissues. And the movement of the drug, it proceeds until the equilibrium is established in between the free form in the plasma and that in the tissues. Then there is a parallel decline in the free form of the drug. So the bound form then dissociates into the free form. Okay, when the free form is reduced due to the elimination by the various factors. Okay, so coming to an important concept, that is apparent volume of distribution. So what is this apparent volume of distribution? So it is the volume that would accommodate all the drug in the body if the concentration throughout was the same as in प्लाज्मा. तो इसका मतलब क्या है? इसका मतलब ये है, ये वो वॉल्यूम है जो तुम्हारा ड्रग को पूरी जो ड्रग का वॉल्यूम को एकोमोडेट करेगा अगर इसका कंसंट्रेशन प्लाज्मा के साथ सेम होगा. ठीक है. सो इसमें हम क्या चीज एज्यूम करते हैं? इसमें एज्यूम करते हैं कि आपका बॉडी वो बिहेव करता है एज ए सिंगल कंपार्टमेंट. सो वी एज्यूम दैट द बॉडी बिहेव्स एज ए single compartment. Okay, so if we assume that the body behaves as a single homogeneous compartment with volume V into which the drug is uniformly distributed, V will be equal to dose administered IV divided by the plasma concentration of the drug. Okay, suppose the total drug in the body is equal to 1000 milligram. Okay, and the plasma drug concentration is equal to 50 milligram per liter. So the volume of distribution V will be equal to 1000, that is the total dose administered, divided by 50, that is equal to 20 liter. So what are the implications of this? इसके implications दो तरह के केस हो सकते हैं. एक, when the drug is extensively bound to plasma protein. So if the drug is extensively bound to plasma proteins, it will have a high plasma concentration. So if it has a high plasma concentration, it will have a low volume of distribution. Second, if the drug is sequestered into the tissues, तो अगर ज्यादातर ड्रग तुम्हारा टिश्यूज में गया तो उसमें क्या होगा, प्लाज्मा कंसंट्रेशन लो होगा और अगर प्लाज्मा कंसंट्रेशन तुम्हारा लो हो गया तो इसकी वजह से तुम्हारा हाई वीडी हो गया। ये चीज तुम निकाल पाओगे ये इक्वेशन से, जिसमें तुम देख सकते हो कि अगर प्लाज्मा कंसंट्रेशन हाई हो जाता है एक फ्रैक्शन में, डिनोमिनेटर अगर हाई हो गया तो वो फ्रैक्शन का वैल्यू क्या हो जाता है, लो हो जाता है। तो अगर वो plasma concentration high हो गया by means of plasma protein binding, then there will be low VD. If the plasma concentration is low over here because of the drug being sequestered into the tissues, then there will be high volume of distribution. So therefore, इसमें क्या करेंगे, in case of poisoning, the drugs which are having larger volume of distributions that are already sequestered into the tissues, they cannot be removed by hemodialysis. So in cases of poisoning, drugs which have a high volume of distribution can't be removed by hemodialysis. So next we'll come to what are the factors affecting distribution. So what are the factors affecting distribution? पहला है rate of tissue blood flow, that is otherwise known as the perfusion. Okay. Second is the extent of plasma protein binding. Third is extent of tissue binding. Then fourth is permeability characteristics of the tissue. So coming to the tissue blood flow. So organs with greater perfusion जैसे कि आपका है हार्ट, ब्रेन, liver, kidneys, they receive most of the drug within minutes. Therefore, they are more susceptible to toxicities. Now, the ones with less perfusion or poor perfusion, like muscles, other viscera, skin, and fat, they receive the drug slowly. Next is your extent of plasma protein binding. तो पहला था what is the tissue blood flow. Second is the extent of plasma protein binding. So we have already known that the drug binds with the plasma protein and these bonds are the weak bond. So the drug will exist in two forms. One is the free form of the drug and another is the bound form of the drug. So what are the two chemical natures of the drug? One is acidic nature or acidic drugs, we can say that, and the other one is basic drugs. So this acidic drugs, they bind to albumin. And the basic drug they will bind to alpha 1 acid glycoprotein. Okay, so the drugs binding to albumin, these are the acidic drugs, and they are examples are barbiturates, benzodiazepines, NSAIDs, valproic acid, so all this. And the ones that bind with the alpha-1 acidic glycoprotein are the basic drugs like bupivacaine, lidocaine, okay, quinidine, verapamil, beta blockers. So what is the clinical significance of this plasma protein binding? So the clinical significance is that the free form, it shows the action, and the inactive form, that is the bound form, it acts as a reservoir of the drug. The free form shows the action, and this bound form is in equilibrium state with the free form. Okay, so plasma protein binding, in other words, it acts as a temporary storage of the drug. Temporary storage of the drug. So what happens? This determines the onset and duration of the action. So drugs which are extensively bound to plasma protein. So there will be less entry into the tissues. So that reduces the distribution. So it will delay the response and will prolong the action of the drug. So the drugs which are extensively bound to plasma protein, there will be a delay in the response and there will be prolongation of the action of the drugs. And this is because they are distributed less into the tissues. So conversely, if there is less binding to the plasma protein, there will be more entry into the tissues. And once it gets more entry into the tissues, there will be more of distribution of the drug. And so there will be fast response and less duration of action. Next is, we have already discussed that hemodialysis in case of poisoning. So hemodialysis cannot be done in those drugs which have a high volume of distribution. So the dialysis is not effective in the poisoning of AVOID drugs. Okay. So AVOID means amphetamines, verapamil, opioids, organophosphates, imipramine, digitalis, and diazepam. Next is in hypoalbuminemia or nephritic syndrome, there is decrease in the albumin. So the plasma protein binding of acidic drug reduces. So there will be more free form and this will result in the more of toxicity of the acidic drugs. Okay. In acute phase reactions, plasma protein binding of the basic drug increases. So more bound forms, so there will be less action of the basic drugs. Okay. Next is another thing to remember is that the drugs which have a high plasma protein binding, they can give rise to displacement reaction with other drugs. Okay. And this results in various drug interactions. Third point, which influences the drug distribution, is the extent of tissue binding. So certain drugs, they have a special affinity for particular tissues. Okay. Like the skeletal muscles and heart, the drug that is concentrated is digoxin. So this will show the toxicity in heart tissues and skeletal muscles. Okay. In liver, chloroquine is concentrated. In thyroid, iodine is concentrated. Okay, and so on. Next, coming to the permeability characteristics of the specific membrane. Okay, so there are particular barriers like the blood-brain barrier, and placental barrier. So these two things also are responsible for determining the distribution of the drug. As because this blood-brain barrier is a short note, I will be discussing this in a separate video. Okay. So this is all about your drug distribution. In this, the most important questions they come usually from the this part, that what is the formula for calculating the volume of distribution? So in this, we'll have to assume that the body is a single homogeneous compartment and the volume that would accumulate all the drug in the body if the concentration was same throughout as that in the plasma. That is called the volume of distribution, and that is calculated by dose administered IV divided by the plasma concentration. So in cases of poisoning, the drugs which have a high volume of distribution, they have a they can't be removed by hemodialysis. And which are these drugs? They can be remembered by the mnemonic avoid. So what are those drugs? The drugs are A for amphetamine, B for verapamil, O for opioids or organophosphates, I for imipramine, and D for digitalis and diazepam. Next thing we have to remember that which drugs bind to which plasma protein. The acidic drugs like barbiturates, benzodiazepines, NSAIDs, and valproic acid, they bind to the albumin, and the drugs which are basic in nature, they bind to the alpha-1 acid glycoprotein like the lidocaine, bupivacaine, quinidine, verapamil, and beta blockers. So if a drug is extensively bound to plasma protein, there will be a delay in response and prolongation of the duration of action of the drug. In cases of nephritic syndrome or hypoalbuminemia, there will be decrease in the albumin. So plasma protein binding of the acidic drug will reduce, and that will lead to increase in the toxicity of the drug. In acute phase reactions, the alpha-1 acid glycoprotein will increase, so there will be less action of the basic drugs. Then certain drugs are sequestered more into or concentrated more into certain tissues like the skeletal muscles and liver. Desoxin is concentrated in liver. The chloroquine is concentrated in thyroid. Iodine is concentrated. Then the permeability characteristics of the specific membrane also determine the drug distribution. Okay, so that's all in the drug distribution. In the next video, we'll be discussing about the blood-brain barrier and placental barrier. Thank you.